morning to all of you. So I would like to first thank the organizers and Dr. Pramod in particular for this excellent conference, for this invitation, and also for being a mentor in endoscopic surgery to our whole team. So he actually asked me to talk on spine surgery in the next generation. And you know, in all these things, there are always two sides to the coin, the good and the not so good. And so I would start off with the good news. So the first good news is that spine surgery will keep growing in numbers. I mean, because the general population is increasing, longevity will more, there will be a huge amount of degenerative conditions. Patient will demand surgery if there is a good life after that. And industry will push for more and more interventions. So we are never going to starve. And there will always be actually cream and cake on our plates if we are a successful spine surgeon. So that is the actual good thing that we need to state. And we all know that change is inevitable. The future is not going to be anything like the present. But this is also true, that whenever you talk of future, it is quite difficult to predict accurately what will happen in the next generation. Because when you assess what will be the improvement, you can only think about with what is at present. But there will always be very disruptive innovations on the way which completely change the future. For example, one generation before, if you ask what is going to be the best thing in the telephone, we would have said smaller ones or different colors or sleek model, but we would have never thought that there will be an internet, email, and camera inside that. Similarly, one generation before, we would have never thought of robots. So I'm sure that in the next generation, there is something that is going to be completely disruptive, what we can't even imagine. So I'm not going to talk and try to prophesy about it. But there will be also a lot of incremental changes in what we are doing now. There will be less invasive surgeries. There will be a lot of focus on MISAB. Navigation and robotics will become standard. Virtual reality, artificial planning, big data, all will be the, not buzzwords, that will be the day-to-day life of what we do. For example, this is going to be true. There is going to be exponential growth. This graph already shows the way which MIS is growing. Now, this will be a strong push from the persons who are doing MIS, from the industry and everything, but there will be a lot of advantage to the patients also, and this will grow. We also know that, as Chabra rightly said, that is navigation and robotics will become the standard. Shared control systems will become the norm. And they will all become very widely used system, and safety and accuracy will be this. You can see here that the artificially based surgical robots market is growing at a 12.4 CAGR, which is really good. Spine surgery market is going at the rate of 3.65 CAGR. Whereas robot is going at the rate of 12.4. So all these will be true. All these we know. And once, as we said, it is not just for going to be putting in screws or putting in a trajectory. But when there is a drill, a burr, and a cutter attached to the robo, it can actually plan anything and everything what the human being can do. And this is most important. So there is a connecting cord where the surgeon plans and the robo executes. But when this cord is disrupted by a Wi-Fi, when it becomes wireless, then there is no meaning for or the need for the surgeon to be inside the operating theater. He can be anywhere. He can be at home. It can be work from home or surgery from home or surgery from a resort or surgery from across the continents. And all these will be actually very, very relevant, and telesurgical systems will actually do a lot. Following Corona, telemedicine and teleconsultations has really zoomed. And in our personal practice, our practice of getting patients from all over the country across the states actually zoomed quite a lot after the telemedicine hub during the Corona. It's only a matter of time when telesurgical systems are also going to be. So the world can actually be your market. You're not going to be restricted by geography. In a few years' time, when you can reach anywhere, and people can, anywhere in the world can reach you, then the world can actually be your market. And that's actually number one good thing. All your decisions, all your knowledge will be augmented by big data analysis, So clear decisions backed and supported by big data will become the norm. So this is my first part. So the future is going to be, it is going to help us with artificial intelligence. It is going to empower our skills with the latest in technology. It is going to make our thinking process, our decision capabilities aided by big data analysis. But I'm just going to talk about what is going to happen to the surgeon. One of the foremost things that we should keep in our mind and know is that all these improvements are not happening because of the surgeon anymore. Because 2 decades before, if you talked of a surgical improvement, it happened because of the surgeon. But now, none of these improvements which are happening inside the operating theater is because of the surgeon. And many of these challenges are going to slowly challenge the importance of the surgeon also. While all of these looks actually very exciting for all of us, there is a danger on the platform on which the status of the surgeon is going to be held. Big data is also going to give us a lot of ideas, but big data is also going to be that in 5 to 10 years' time, every decision of the surgeon will be documented and it will be accountable, and you have to justify on what basis that you based your data upon. No longer it will be possible that if you go to Vikas, it will be operated like it. If you go to Rajkumar, it will be operated. If you go to Arvind, it will be operated differently. Everybody has to follow a line and justify on the basis of big data. And that's going to restrict and also streamline all of us. It is also going to change because in 2020s, every decision of the computer, which is helping us and aiding us, has to supervise and okayed by the doctor. But there is ample proof in 2030s, every diagnosis and decision of the doctor has to be approved by the computer. The big data is going to be so rigid, it's going to be so inclusive, it's going to be so comprehensive. Already in Oxford and in some places, any MRI which is certified as normal has to be okayed by the artificial intelligence to say that the radiologist has not missed anything over there. Now we know this big data and deep learning and gaming and all these things actually makes the computer more analytical and it keeps learning. This is the most important, interesting and also dangerous thing to the human mind, that the computer can start learning by itself over a period of time. And this is going to be really much better over a period of time. So where will we have our supremacy? And in all the things that I said earlier, there is also a danger or a challenge to us. I won't say danger, it's a challenge to us which we have to face. When I say the world can be your market, on the other side of the coin is also the world will also be your competition, will be the world. So a person from Pune or a person from Coimbatore need not think, where will I get my best consultation from? Initially, they would have thought, from Pune, let me go to Bombay, from Coimbatore, let me go to this thing. But now they are going to think, why not I get the best surgeon from Tokyo and San Francisco and New York to consult me? It just costs me $100. So your competition is going to be from across the world. So we really need to brace up that although you may be acting locally, your thought process and your competition is going to be local. Slowly, over a period of time, in your hospital, in your setup, the robo may be the best surgeon and also the preferred surgeon in your own setup. You may come to a situation where the patient is coming and asking, okay, sir, just tell me what my big data analysis, whatever is available to you is going to be available to him. And he is going to say, I think in the available circumstances and evidences which is available, these big data analysis are going to be made available to the patients also. He will say that I need an L4-5 fusion, and what is your software and what is the robo which you are using. And it is not, doesn't matter whether it is Rajkumar or Siddharth or Rajai or Rajesh or Dr. Rajshekharan. He is going to ask, what is the robo that you are using? And how many have you used? And so this is going to be a big challenge. So competition will not be on smaller platforms. Competition will be on larger platforms. And the surgeon has the problem of that he will become a small part of the whole process. Now this is one change that we have to be ready for in the next 10 years, and we have to be. Because a single surgeon entity is going to be lost. It will fade away. And surgeons cannot compete with big institutions. And big institutions will struggle to compete with corporates and multinationals. Just like in the US and in many places, smaller hospitals and everything have been completely eaten away by the multinationals. The surgical teams will be also completely eaten by multinationals. The group, maybe a spine group, like I know there is a famous group in Mumbai where they say, we are spine. But in the next 10 years, VR Spine will be one surgeon in Bombay, one in Coimbatore, one in London, and one in San Francisco, because everything is possible, interchangeable between all of them. These complexities we have to beat. So although group practice will be the norm, but the team members will be completely different. This is going to be a great game changer, and we have to be ready for it. The team may not be just surgeons from across the world. The medical team may be more of technical specialists. Well, if you are going to have everything certified by the big data analysis, by computational analysis and softwares, planning is going to be done, everything by virtual reality, then the medical team will be more of technical specialists with one supervising surgeon, but the other members of the team will be a data analyst, a system specialist, a robo and AI specialist, etc., rather than a group of surgeons. Now, this is going to happen, and this is actually, now we have robots. Now I really know that what is the value of these technical persons rather than having another fellow surgeon next to me. So this is going to be different. So over a period of time, hierarchies and leadership are going to stumble. So if knowledge can be obtained without labor over a period of years, everything is available on internet. When big data is available and decisions will be by computational analysis, it doesn't need experience of maturity of thought. Years of experience can be superseded by artificial intelligence, which is readily available for you. Technical expertise can be substituted by navigation and robots, and planning is performed by augmented reality. So the patterns of leadership will change. In every group, no longer the gray-haired and the bald man person will be the leader. There may be another person who is more good in all these things, who will actually challenge and who will be actually more valuable to the whole team than a person who has had 30 years of experience and fixer ideas about what should be doing. So we have to be. So how fast will these changes happen? These will happen much faster because there is one common factor which will drive both the surgeon and industry, and that's competition. And competition is going to be 10 times more in the next 10 years than what it is now. Because there are so many doctors, so many fellowships, so many fellowship-trained surgeons, opportunities for training is huge, and people will find that they have to keep changing as fast as possible or run as fast as possible to be even in the same place. And the pressure for any one of us to be seen as different and better than your peers is going to be really very high. Now, Deshpande actually mentioned that why MIS was taken up only by individual surgeons and not by big hospitals. And you will know that this MIS was giving an opportunity for a surgeon to look better and also different in the eyes of the patients and peers. So this will go through the whole state of the spine. But change is certain, but a lot depends upon which direction these changes will happen. A lot depends upon who will navigate the future. Is it the patients in control or surgeons in control or the industry in control? Now the industry will be a major driving force because the CAGR is really expected to be, you notice it's only 3.9%, but it is in billions of dollars. And the industry will try to convert spine into a spine market, patients into customers, surgeons will become industry partners, and success will be by balance sheets. If that is what the industry will want that, and it depends upon whether we are going to be a partner with. Technology and new innovations and new instruments will splurge. You have endoscopy, there will be 7, 8 modifications of endoscopy because every modification gives more money to the industry. In the new devices, the profits will lie. So doubtfully useful technologies will be unleashed. For example, you know, for disc degeneration, there is nothing we have not done to the disc. We have burnt it, we have electrified it, we have put enzymes into it. 16 types of intervention has come in the last 2 years, last 10 years, and the outcome often no better than conservative treatment. So there is going to be a lot of innovations which will come, which will not give us great benefit, but will be extremely expensive. And so we all need to be sure about the Scott's parabola. If the industry is going to be in the lead, we have to be careful over here. Mentorship challenges also are going to be there because the surgeon's life in training are real life situations, but there is going to be a lot of simulation. So slowly the education is changing from operating theater to labs and from hospital to societies and from mentors to industry. And surgery is different from flight simulation. So we all need to learn surgery inside the operating theaters, not in workshops, not in conferences. And we need to be, because all these are as important in learning to be a surgeon than as to be just only the techniques of surgery. So when the patient is the driver, you will see that they don't like to go to the hospital, they don't like a visit to the doctor at any time. 86% felt that they would really like never to visit a doctor. And alternative medicines is going to be the way. I showed you a slide where the CAGR was 3.69% for surgical instruments, but here you can see that the Ayurvedic products and alternative market is actually growing at a CAGR of 22%. This kind of big jump will not happen even in surgery. So when somebody gets a problem, when he gets a problem like this, the real competition for us is not going to be a fellow spine surgeon, it's going to be Ramdev. I mean, that is going to be a possibility that people will actually look at all other. In a period of time, alternative therapies may become the mainstay and this. So the surgeon, where is he? So we should not feel diffident on all these things because it's just that whether you want to be the healer, friend, confidant, or you want to be the gatekeeper, case manager, it depends upon what role we are assuming to be. I still think there is a great opportunity for us to be the healer. So I don't think we should try to compete with the robot. I mean, we should actually have robo by our side, the robo behind us. Just like we say every successful man has a wife behind him, every successful surgeon should have a robo by his side and artificial intelligence computational analysis by it. Can't compete with it, but actually we should be different. So even though we will be this as a modern spine surgeon, I think we should not forget the essence of what was there many decades ago, that when you see the patient, there was nothing between you and the patient. There was no other stakeholder, no other middleman, no other profits. And we just looked, every single doctor that time looked what is good for the patient. And if we just maintain that and look at our professional worth, that we will use our power to help the sick to the best of our ability, I think our position can never be questioned. Because as a surgeon, if we are willing to be as a guide to the patient and his family, a true friend to our family, looking only at his interest as the best interest. As a healer, that's very important. Not just looking at what kind of incision, what kind of implant, but as a person who will help a person in pain and as a mentor to our colleagues and a person who are here. I mean, there is always be a meaningful space for all of us over here. So 20 years from now, everything will be 100% different. How different? Externally, everything will change. But I think as a doctor, if we don't change, there is always a space for us. So thank you very much for this opportunity to talk. Thank you.